I'm so glad to be here with all of you. And I hope that all of us embrace here that we are all leaders wherever we are in our career development, and we need to encourage um, all the people that we are mentoring and coaching around us to really embrace their role as leaders. And I also want to just acknowledge we're all in this journey together. I'm always amazed. I just transitioned into a new job several months ago as in the Veterans Crisis Line. And I'm amazed at how much I can mess up every day and learn from it and grow from it. And that's part of the journey too, of realizing that wherever you are in your career, there's more to learn and there's better and better ways to grow our leadership. So I wanted to kind of look back. I had recently worked on a chapter on leadership development with my boss, Matt Miller. And these were some of the things as I was reflecting on things that we could kind of come and discuss today. I was thinking back about this chapter and lessons I learned as I was doing a literature review for that I thought might be fun for us. So if you go on to the next slide, I'll talk to you just briefly about, what does a leader truly look like? If you Google, this is really odd. Look at the different images. You know how they have all these pictures come up of different images to think through what does the internet have us look at the leader? There's people who are out in front. There are people that I really don't like this one, the puppeteer, where we're controlling people. There's people with up on a pedestal. And then I think there are also some good images here of what I would call good leaders in team-based care, which is a lot of what we want to do. And so what we think of as leaders across time has changed, and so has the literature. So one of the things that, if you look back kind of in the early literature on leadership, is there was really this belief of trait theory, like you're either a good leader or you're not. You have to have these characteristics, and oftentimes those were traditionally masculine types of leadership traits, real assertive, aggressive, kind of even on the negative terminology of that you needed to have that in order to be successful in your career. And over time, as people studied this and learned from this, we moved more to behavioral models of leadership. And in behavioral models of leadership, this is really looking at, okay, it's not just about these characterological traits, and there's not just one way to do this, but behaviors that initiate structure and consideration of others, providing organization, kind of team focused efforts. Those were some of the behaviors that early leadership theories really focused on. In fact, there's an approach called the grid approach, and it's built on two major factors. How do you care for people, and how do you work towards goal attainment at the same time? So a lot of people focused on that. And then there's a transition over time into what's called situational and path goal leadership constructs. And this really, in contrast to behavioral approaches, really talked about how different leaders thrive in different situations, that the situations may need different types of leadership styles, which I thought was really fascinating. So if you plopped me in a completely different setting, I might struggle based on the types of traits, characteristics, leadership style I bring, where someone else might flourish. And so they started looking at, okay, how do we learn from these different situations over time, and how do we help people adjust their leadership style? What one group may need, what one organization may need, may be different than another, and we have to adapt. And in fact, a lot of Fortune 500 companies continue to train using this type of model. And then over time, we also began to see the emergence of something called transformational leadership. And there's a lot of very positive literature in this, approaching leadership about focusing on your team, focusing on employee development and empowerment. We've learned a lot over the years with that. So Burns really describes this as including ways of how do we engage our team? How do we connect our employees, bring out their strengths? I know I personally like a lot of this. So how do we focus on increasing the character of our team, their self-efficacy, their positive emotions? So there's much in the literature that's still present today around this transformational leadership construct. And then authentic leadership. And there's a lot I've learned from this. One of my prior bosses really focused on this, and it's looking at leading from one's own convictions and working on relational connection and interaction with employees. And authentic leadership really describes kind of 5 different dimensions or characteristics that all of us would want to focus on developing to become an authentic leader. And it's things like passion or purpose, our values being lived out in our behavior, our connection to others. There's a focus in it on self-discipline and consistency, that people can come to rely on that for us, and heart or compassion. And that those all together truly make an authentic leader. And then we have also seen the emergence, this is something I know VA has embraced, which is what's called servant leadership, or some people call it service leadership if you don't like that particular term. This really arose out of the work of Greenleaf and focuses on leaders attending to the needs of their employees. Again, that theme of focusing on empowering our employees, but we lead through serving others and being a part of showing and demonstrating that instead of a kind of power down approach. So I share this with you to think through as you begin to kind of look at methods of developing your own competency in leadership. I think it's great to kind of look at the different theories and see which of these kind of models sits best with you, or is it a combination, because that'll impact some of the different things you may wish to focus on and read and do self-assessments on. I'll share a little bit more on that in the next slide. But one of the things I really like to focus on when people on my team that I'm working with is just like in clinical behavior. We don't change provider behavior. They don't learn new skills by just reading a book, right? We learn through practice, and that's why I have this picture of this violinist here. It takes years and years of practice, and I always am amazed at how much more I have to grow, and I have to practice the hard skills. And just with that, leadership competency is something that we really need to set some individual goals on and focus on and do self-assessment and get feedback from others to say where are our strengths and where are opportunities for improvement. And really, we need to be looking at, I feel so funny, Susan McDaniel, you're on the call and I'm quoting you. We talk about within primary care mental health integration, growing our competency over time. And for those of you who are not familiar with integrated primary care, many of you are experts here on the call, it's really a very different type of care than doing psychotherapy in a traditional mental health setting. And so our poor psychologists and social workers, if we throw them into primary care, they don't have the different skill sets in the same ways that we need to develop to practice in those arenas. And we want to look at what are specific skills that we can grow when we put someone in a new clinical realm. Just like that, we also want to do that with our leadership. And there's lots of different models here that you can work from and look at, and I'll talk a little bit about some of those different competency models. But I'm going to pause here for a moment, because some people may not always think that we can develop all of the different parts about leadership. And there's a common question here as I was reviewing the literature in this is, what about emotional intelligence? We need emotional intelligence as leaders. And there's a debate about this. Is emotional intelligence something that we can develop over time? I'm curious in the chat box what y'all think. Is this something that we're born with, or can we develop? All right, Stacy says, to an extent, I think so. Allison, yes, I say develop. Yep. This is one I debated with my husband is a leadership expert. He's got his doctorate in educational leadership. And I debated with him about this over time. And most recent studies say, yes, you can develop emotional intelligence. Some people have a higher level kind of when they're coming in, but if we focus on that particular skills, it can be developed. And I would argue that all of our different leadership skills are things that we can develop over time. So next slide, I'll talk to you a little bit about, okay, what kind of leadership competency approaches are there out there? So just like if you have learned to practice in psychiatry, you've learned to practice in primary care, a lot of our training models have developed competency-based approaches where we're looking at behaviors and skills. The leadership theory has gone the same way. And so some of the early work on this, Katz and colleagues, even back in the 50s, talked about, okay, there's 3 different categories of competencies for leaders. It's technical skill, it is human skill, that relationship skill, and then it's conceptual skill. And over time, this morphed with different types of additional skills, problem-solving skills, social judgment skills, knowledge. But there are some things that are what we would call horizontal competencies. So my ability to do problem solving, no matter what environment I'm in, is going to be useful to me. However, my expertise in suicide prevention, while I may use that in a business setting that I might happen to be in, is not the same. And so that's more of a vertical competency over time. It's something I need for the particular work I'm in right now. And so as you're looking at what you want to develop with yourself, you want horizontal competencies that you're growing in. Learning how to have crucial conversations, things like employee development, personnel development, those things will cover across time. And there are things for you as an OBGYN and different skill sets that you need to develop to become an expert in that particular arena. So what I'd encourage you to do, if you haven't already done this in your particular areas, is what is the competency approach within your discipline? And then also think through what is the competency approach from a leadership perspective where you want to learn and grow. And that will guide you in your leadership development over time. So something for you to think about here is where can I go and find some of these things? And I have some different references for you, but a good starting place is actually on the next slide. I love this picture of this little kid looking in the mirror. Boy, sometimes I do that in the morning and go, how many gray hairs do I have in COVID now? Where did this come from? But this is a deeper kind of self-assessment and reflection. And I encourage you to look through, we talked about different theoretical models of leadership, and you may kind of be drawn to more one than the other, and I encourage you to look through that. There's the behavioral model of leadership there, and there's a questionnaire you can kind of download and take, and it really looks through from that task-related behaviors, kind of emotional regulation and connection with others behaviors, if you want a behavior-based approach. This may be a self-assessment to kind of look at, okay, what are the different behaviors I want to grow in? Or if you were drawn more to that path goal model of leadership, those can kind of look at kind of what styles that you are kind of more likely to lead from and where you want to develop, all the way down to kind of servant leadership, authentic leadership. These are all different things you can practically use. So I wanted to just give you some tools, and I'll talk a little bit later on. You can use some of these tools in what's called a 360-degree assessment. And I know I've done these probably about 4 or 5 times over my career. The 360-degree is when you use an assessment like one of these, and you have the people above you, your supervisors or past supervisors, rate you on these things. You also always rate yourself too, which is interesting. How does your boss rate you compared to how you rate yourself? And then you get a group of peers, trusted peers, who'll give you real feedback, and you have them take that assessment and look at those results. And then people that you supervise, and that's why it's called 360, because it's all around you. And you take that and you talk with a trusted mentor, a coach, a colleague, where you can really look at, okay, here are my great strengths, and here are some things that I want to work on from this. It is one of the most valuable ways for you to kind of get started on your goals and leadership competency development, is taking a hard look from all different areas and getting feedback from others in that as well. Next slide. I'm going to focus a little bit about, okay, we've got a little bit about what's your leadership theory you're connecting with. Where can I get some self-assessment on that? Where might I go? And these are just some things that we encourage for you to look at. Find a mentor. And it doesn't have to be a formal mentor. I'll tell you, I feel like I have a gazillion mentors, some of them on this call, who I've looked to over the years for encouragement, growth, coaching, training at different times. It doesn't have to be one mentor. In fact, I would argue you need multiple mentors over time. And some of the things I'd encourage you to look at is you have mentors within your field. I have psychologists who've served as mentors to me, but I have a primary care chief who's become one of my dear friends who I just adore and who has coached me over time because I loved her leadership style. I loved watching her in primary care. I loved her strategic planning. It wasn't that I was going to become a primary care physician, but she was teaching me how to lead. And so think through who might you want to reach out to and talk about key areas that are outside of the areas of your own clinical training. Sometimes we are really focused on content expertise, but we also need to be looking at how do I do strategic planning? How do I learn about program evaluation? How do I learn about advocacy and become a better communicator? Look for people that you're like, I like the way they do that, and find ways to get to talk with them and have them coach you a little bit. Looking at also specifically, and this, when I started writing this chapter, it was before COVID, and then COVID hit, and I just feel like I learned so much more about leading in a virtual environment. We have to develop competency in leading virtually, right? All of us have learned that now. How do I connect with you here versus how I might connect with you every day in an in-person setting? And it's how do I lead a team when I have 20 people on the call versus I see them all in a room and I'm eating donuts with them? It's a very different way of connection, and it has to be more planful and strategic. So I think there are some specific competencies that we actually learn from a virtual standpoint. Emotional labor skills. I'm curious, has anyone heard of the term emotional labor before as applied to leadership development? This was a new concept to me. My co-author on this, Matt, really introduced this to me a few years ago. He and I were talking about, he said, Lisa, the exhausting thing is the emotional labor of day to day. And I'm like, well, you know, we're psychologists. Of course, like it's emotionally laborious. He goes, no, not about psychologists. It's about the labor of taking care of your team and being able to address whatever's coming up, because we have to behave well in professional settings. This is probably the hardest thing for us. You know, a patient is erupting in front of us and upset about something, and we have to stay calm, right? Okay, I just lost a $500,000 contract. There's an ethical issue going on. There is sexual harassment that I'm dealing with. All of this raises emotions in us, right? And yet, how do we have to handle that? We have to put on a professional persona. When we are having to do that professional persona over time, that is exhausting, right? And then we need to go have time to go walk or talk to a friend or do something else to help manage that. And having good emotional labor techniques is an important leadership competency we need to develop over time. Another kind of key construct here that I would mention to you is looking at how do we encourage the full symphony of ourselves and others. And this is where I'm talking about intersectionality and leadership. I see one of my former residents on here, and just so glad to see you, Liza. This is something I also actually learned from another former resident, Jason Purnell. And Jason really talked about diversity in a moving way that I will never forget. He really taught me about how diversity within all of us is a symphony that's bringing together each of our different characteristics. So, for example, the trombone section may represent our socioeconomic status. The flute section in a different area might reflect our religious or spiritual backgrounds. Another section may have race and ethnicity. Another section may be sexuality. So all of these different things and the different characteristics that we have come together in a beautiful symphony, and we have to learn, each one of us, all of the different ways our symphonies are playing at a given time. And I think that's really important from leadership, that some sections may be playing louder for people at different periods based on the context in which we're in. And we have to be better leaders by learning how to help be able to listen to the symphony and respond to the symphony in each individual. And I just thought that was a beautiful metaphor, and he's written about this, and I continue to learn of that. How do I bring out the best symphony in each group that I'm working with all of the beautiful characteristics each unique individual brings? And that is a leadership quality that I know I'm trying to always grow in. Ethical decision-making in leadership environments. Boy, this past year with COVID, I have faced some very difficult ethical decisions that I never thought that I would have to face. And I've had to do a lot of consultation, a lot of growth in those areas. And so challenging myself to stop and pause and think through. And then how do I enhance managerial courage? Leadership demands courage and difficult decisions and speaking truth. And they are not pleasant all the time. And I know part of my mentors and coaching and colleagues, I feel their strength come alongside me when I'm in difficult situations and help give me managerial courage, help me to grow that. Next slide. And then I want to come to a conclusion here. It's just to help you to see that our leadership also grows over time based on what systems and contexts we're in. So I talk a little bit about on the next slide. So give you an example. What do I need to know at a policy, legislative, and accreditation level if I'm serving in a clinic versus when I become a service chief versus become a head of a healthcare system versus I serve at a national level? My growth in this occurs over time. So one of the things I'll tell you that I never, ever thought that I would know anything about was all of the legislative guidance governing crisis call centers in the country. There's all kinds of legislative policy around this nationally, and I've all of a sudden been thrown into that in my new role. I hadn't had to have that before. Versus when I was in clinic, I had to be familiar with all the joint commission standards, the CARF accreditation standards. There's different things in policy, but maybe I wasn't thinking about laws that folks were making. And now I have to comment about laws that folks are making and tell them why it's good or not based on those different things. So we grow in our leadership based on where we are in our systems, which I think is just so much fun. And I hope you enjoy it as much as I have. So a few things in closing to think about. What are some next steps for you in leadership development? Consider a self-evaluation or a 360. Develop a particular professional development plan where you're actually, just as you were in school, back when you were in school, and kind of thinking through, okay, these are my courses, and I'm on to the next slide. I'm sorry, couple over. I go too quickly. Think through, what is my plan for this semester? How do I want to grow my leadership? What am I planful about after I do my 360 and evaluate that? Where do I want to go and how do I get there? What books do I need to read? Who do I need to talk with? Seeking out leadership development programs, volunteering for opportunities in those different areas where you want to grow, getting into mentoring, and then what I call get into a chips and salsa group. This was probably one of the best things that someone told me. We're in San Antonio, so, well, most of us are, so we can relate to this. When I was a new chief, this was the best advice someone gave me, is said, go find other chiefs who understand what you're going through, because you're going to be isolated in this position. And once a month, we would have a virtual chips and salsa meeting. For us, we were complaining about, what is VA central office requiring us to roll out this month? Or how are you dealing with this new legislation? Or how are you doing this? And it was this place of community where people were dealing with the same things that I was dealing with as a leadership. And I learned from the different challenges they brought to the table, and it was in a safe place. So how can you create your own chips and salsa club or chocolate brownie club or whatever it is you like to eat, breakfast tacos? And lastly, How do we expand access to leadership development opportunities? I think we're getting more creative now with COVID. We've had to, but a lot of times people go off for a week for leadership development. What about folks who are single parents who can't go off for a week, right? Or they're helping take care of their older parents. They can't travel, or their financial challenges, or people aren't aware of different things. How do we make sure that underrepresented individuals get access to these leadership, are aware of these leadership opportunities? How do we encourage people to think through that? How do you actually go back and look around you and go, this is a great person, we need to get them the leadership, encourage them. There's so many people who don't apply for the programs, they don't think of themselves as a leader. So who can you encourage to go forward today? I am going to stop there, but I hope that gives you a few things to think about of where can I go from here to develop my leadership skills and how can I help other people.